presentation on evaluating the benefits of electronic health record and computerized prescriber order entry through the dimensions of cost, access, and quality. According to the World Health Organization, health is a state of complete physical, mental, and social or spiritual well-being, not merely the absence of disease. Achieving the optimum health of the nation is dependent on the cost, access, and quality of the associated healthcare system. Let's take a look at the United States' current performance. According to the Institute of Medicine estimates, 44 to 98,000 Americans die each year due to medical error. In reference to cost, healthcare accounts for over 17% of America's gross domestic product. America spends more on healthcare than any other industrialized nation, yet 47 million, or 15% of the U.S. population, remain uninsured. Obviously, from these statistics, there is great room for improvement in America's health system, and information technology is looked at as a mechanism to create the changes needed to reduce errors and increase effectiveness and efficiency, which could simultaneously reduce cost and increase access. The two technologies that are most often discussed in achieving these goals are electronic health record and computerized physician order entry. As more institutions have moved towards implementing these systems, however, there have been health and cost-related outcomes contrary to these aims. To effectively illustrate this point, I will present EHR and CPOE through the dimensions of cost, access, and quality. According to the article, it ain't necessarily so, the electronic health record and the unlikely prospect of reducing healthcare costs. Electronic health record often leads to higher billings. Due to the increased coding levels associated with EHR, providers benefit from greater capture of charges, which increases healthcare costs without any corresponding improvement in health outcomes. In addition, EHR implementation has been associated with declines in provider productivity. In a study conducted by Kaiser Permanente, the use of EHR resulted in a 5 to 9% decrease in office visits placed by telephone contacts. It also remains unclear whether EHR will enable providers to see more patients. Finally, cost savings with EHR and CPOE related to error reduction vary. Due to this inconsistency, EHR implementation cannot yet be linked to increased health system savings or reductions in malpractice premiums. In the dimension of quality, computer prescriber order entry has led to unexpected consequences. According to the article, unexpected increased mortality after the implementation of a commercially sold computerized physician order entry system, CPOE has caused delays in care due to the increased time required to enter patients into the system before orders can be made. In addition, once the patient is registered, computerized orders take longer to complete than written forms do. This increased wait time in ICU and transport settings can have significant consequences in patient care. According to the study, before CPOE implementation, antibiotics and vasoactive medications were administered according to the national guidelines. However, after CPOE implementation, fewer than half of the patients received these necessary therapies within these timelines. According to the article by Joan Ash and colleagues, when systems that have such complications remain in practice, workarounds are developed by users. One example of this would be physicians verbally ordering medications and entering them into the system at a later time when the medication has already been administered. This places the patient at risk of receiving the medication twice, especially in high acuity settings where medications are critical. This would cause severe patient harm. When it comes to electronic health record and computerized prescriber order entry and the dimension of access, certain questions must be asked. Will EHR and CPOE result in increased efficiency, allowing clinicians to see more patients? From the aforementioned articles, it is apparent that EHR and CPOE can cause significant delays, and there is not consistent evidence that these technologies will allow for higher provider-to-patient ratios. Will reduction in error lead to decreased cost? Yes, if the prevention of error is consistent. However, according to the evidence, this is not the case. Finally, will EHR and CPOE improve quality and reduce cost, allowing for more people to receive healthcare services? While these technologies offer great promise, their full potential has not yet been realized. But wait a minute, there is hope. The Veterans Affairs Administration was formerly known as a bureaucracy, providing mediocre care. This was changed through organizational initiatives, creating a culture with commitment to quality and value, and the successful implementation of information technology. The Veterans Affairs Administration now leads in clinical informatics, quality improvement, patient satisfaction, and clinical benchmarks. The This Day system greatly contributed to this achievement. I would like to close with a quote from Martin Luther King. Dr. King stated, "Of all the forms of injustice, inequality in health is the most cruel and inhumane. Given that healthcare professionals have entered into a social contract with society, we have a responsibility to work diligently on success in the dimensions of access, cost, and quality. And what is abundantly clear is that information technology will play a tremendous role in the effort to improve quality, reduce health disparities, increase access, and make healthcare affordable for all people." Thank you for watching my presentation, and have a great day.